I've made plenty of videos before about what if the female genital anatomy is too big, and usually we're talking about the labia minora or the clitoral hood. But what happens if the actual clitoris itself is too big, and can that be a problem? So my name is Dr. Saib Gallagher. I'm based here in Miami, Florida, and I have expertise in functional and cosmetic genital surgeries, which is a large part of my practice. And sometimes we do see folks who are dealing with what we call clitoromegaly. So clitoromegaly just basically means a clitoris that is too large, and there are many reasons this can happen. What I find in my practice, in most cases, we never find out the reason. It's just what we call idiopathic, or just the way the patient developed. Sometimes it can be because of hormonal issues, certain diseases can cause it, or if the patient was taking, for example, steroids, anabolic steroids, or testosterone, the erectile tissues in the clitoris will grow. And oftentimes it may look, when the patient's examined, it may not look too impressive, but the patient will report that with arousal, those erectile tissues will get much bigger, and sometimes it can cause them distress or even functional problems like chafing and rubbing. So what can be done about this? So first of all, we do an exam when we see the patient, and typically when we examine the clitoris itself, we expect it to be tucked in the labia minora underneath the clitoral hood. So we're looking for any sort of abnormalities there, such as clitoral phimosis, which is tightness of the clitoral hood itself. So just in the same way a penis can get phimosis or tightness of the foreskin, we rarely do see this in the clitoris, which can give irritation and sometimes give the impression of clitoromegaly. But in general, the clitoris itself should be less than about 1/2 centimeter at the glans, just depending on the patient's anatomy otherwise. So we'll do an exam, and then we'll figure out obviously what the patient's goals are, and in some cases we will go ahead and do a clitoral reduction itself. So this surgery is a little bit involved, and there's not many surgeons who are familiar with the anatomy down there, because what we really need to be careful of course, is to preserve the nerves, because the clitoris is incredibly important for erogenous sensation. So oftentimes we'll be reducing the glans itself. We may be tucking or pexing or lifting the clitoral bodies back into position, and we do this with a nerve preserving technique. We know where the nerves are on the clitoris themselves, itself, and therefore we can spare it. So typically the downtime from the surgery, and I should mention, oftentimes at the same time, in order to balance and harmonize the genitalia, we will be doing at least a clitoral hood reduction. Oftentimes it will be combined with a reduction of the labia as well, if the patient chooses to do so, but it's entirely up to the patient and what their needs are. So downtime from this surgery is usually about a week off work. I always say about the genitalia, I never fail to be amazed at how much they can swell. If we operate on, let's say, the face, it can double in size, but the genitalia can easily go up to 4 times the size, because it's difficult to elevate down there. It's what we call a dependent area. So ice packs, all of that are important. Swelling does go on for a while, and usually most folks won't be able to return to sexual activity for about 4 weeks, typically after this surgery, and it takes a long time for the swelling to go down to see the final results. But this is a treatable condition. It causes a lot of distress to folks who have it, because, for example, folks who identify as women may look down there and have the impression that there's a penis there, especially when they are aroused, because ultimately the anatomy of the clitoris is a lot like the penis, just without the urethra where you pee through. So when it enlarges, it can definitely give that impression. This is a surgery I love doing. It's challenging, but we certainly get requested to do it, and that's how we do clitoral reduction.